Clearly, one of the major advances in lung cancer management, specifically non-small cell lung cancer management, is the identification of what are termed as driver genetic alterations that can be targeted for therapeutic benefit. And one genetic alteration that has gained some attention is what is called as FGFR1 amplification, and FGFR stands for Fibroblast Growth Factor Receptor 1 amplification. There are several FGFR receptors, FGFR1, 2 and 3, and apart from amplification as a driver genetic alteration, it is well recognized in several malignancies there can be translocations involving these receptors. And so what we are presenting in this sort of a retrospective analysis is that we have identified about 50 patients who had FGFR translocations, and these translocations appear to be driver genetic alterations, and in about 1/3 of the patients other driver genetic alterations were identified, such as KRAS mutation, such as EGFR mutation, but in about 70 to 75% of the patients FGFR translocation was the only driver genetic alteration identified. In addition, in one of the patients who had an FGFR2 translocation, treatment with FGFR inhibitor produced a partial response, and the disease was controlled in that particular patient for 11 months. Unfortunately, subsequently, the patient did have disease progression and as of now, unfortunately, has died of his lung cancer. Nonetheless, this data suggests that appropriately targeting, treating these patients who have FGFR translocations as their driver genetic alterations can provide clinical benefit. Based on the total number of tissues analyzed, it appears that FGFR translocation is not a very common event. In fact, it was identified only in 0.4% of the patients. Nonetheless, if identified, appropriate treatment with FGFR inhibitor can provide meaningful clinical benefit. And so until now, the focus was on FGFR1 amplification, but what is important to recognize that lung cancers can have FGFR translocations, which can also have therapeutic implications.